Hey, welcome back to SUPERSTAT, where we explore the science, strategies, and stories behind laboratory medicine. I am A.A. Odie,
I'm Melody.
Hey, I'm Stat Stephanie.
and today we're delving into a topic both groundbreaking and a little controversial. These DIY fecal microbiotic transplants. As a microbiologist, we have plenty of fun words, but throughout the episode, you'll hear us refer to it as FMT and their potential impacts on mental health disorders and the future of psychiatry and all sorts of other fun endeavors.
So, if you love a good Netflix documentary like Dr. Nelson and myself do, then you've probably seen the latest one. It's not too latest, but it's fairly new from 2024 called Hack Your Health: The Secret of Your Gut. And it was hosted by a German scientist named Julia Enders. And this film delves into the intricate world of gut health, and it explores our digestive systems and how all of those systems work together to influence our well-being. And with one of those stories following a doctoral student who uses this FMT, so this fecal transplant, for her own GI issues, finding her own doctors, etc.
Yeah, her own like donors and stuff when the doctors told her she couldn't do it. But I
Also,
do
you.
think we need to like back up for the chemist in the room because this is not my space. This is totally Erin's space. I know
Wow.
FMT, like what it is, how it's done. I've studied it before. Our micro department makes them up for inpatients, but I've never actually done the process myself. Like, so Erin, can you like walk us through that?
You want Aaron to
So,
walk us
what,
through DIY fecal transplants? Okay.
I mean, not DIY, like the
why do
clinical
you always?
version of
Why
this.
are you
I
giving me
don't
so much crap
understand.
today, that Stephanie?
Like,
Why so much crap?
go is a.
Uh,
Tell us
I
how
mean,
you
if
have
get
a
you
ready,
have
practice
a
guys.
job.
blender and there are actual YouTube videos where people are doing this at home, but we're not going to get
The
into that. But
the
like
puns are
from the
so.
medical side, like, can you walk us through like why it's just like a normal thing we do in hospitals,
Yeah, and I'm
right?
gonna get ready to
Oh,
post it on Pinterest. So go ahead and
okay, I'm gonna hear you like, oh. Okay, so this should be kind of fun to answer. So fecal transplants, they're involving bringing in healthy donor samples from a patient um, into another patient who potentially has had their GI flora wiped out from either antibiotic therapy or other things along that lines, and we're trying to restore that microbiome back to the actual patient. So there's fun descriptions of this. Historically, actually, when I looked in like ancient China, where they were talking about people drinking this yellow orange slurry that would eventually help with GI problems. So it does date back pretty far. Don't go doing this. Don't like it. This is not the time to do that. But the hope is to actually kind of restore that flora. And typically and traditionally, this has been used for Clostridioides difficile, and that's what um, is the actual bacterial name that causes what we call C. diff. So there are recent studies and that have been shown how your gut flora is connected with your brain. So showing that by restoring this flora, it can have nice mental health implications as well. So
maybe that's
But
wrong.
like,
That's wrong with so many people. You're backed up. Yeah.
back it up.
no, no, but like, okay, so when they do donors, like healthy donors in the hospital, they're like family members usually of the patient, right? Like they're people
Yeah,
that they know and are in their same environment. Isn't the environment important for that with the
yeah, it's
microbiota
going to
too?
be the environment. They are pre-screening these because you don't want to give somebody that actually has a stool pathogen. So someone that family member that might have salmonella, you don't want to be giving them that stool and transplanting that into them. And they're even checking some of the strain types as well. So the FDA's even kind of waved in a little bit with there was a couple of these fecal products that you can purchase physician wise, but where they have certain strains that are supposed to kind of help you along the way.
Hmm.
Okay.
But people
Help
are
me keep
doing this
on
at
that.
home.
Yes, people are very eager. to have great gut flora. So besides the probiotics, they are like, I see that Melody has better.
No.
But no, yeah, so people are
Okay.
doing this at home. So, okay, get us back
Yeah,
on track.
this is another level of jealousy here. Melanie has better gut flora than us. She's more regular than us.
Okay.
So not
But
only are
there's
people doing this at home, but there are also books on Amazon to help find donors and do it without medical help. And there's even YouTube videos on how to do this.
I don't think I need to watch those.
No, you
I
probably
think we
won't. You
want to
won't look
stick
at your
there.
bullet blender the
I'm
same
curious.
anymore.
I just and also
I'm
like,
curious.
are you using that blender ever again? I would hope not.
Probably
I don't
not.
know. I
You
just
probably have
don't.
like a
Anyway,
colander or two, and okay, keep going.
I can't get there. I just think we need to be clear though. Like the FDA doesn't have any formal approvals for like these other uses, right? Like it's approved in the inpatient environment, but not
Yes,
outside of that.
yes,
Correct?
it's indicated for certain indications, it's certain strains in certain situations, and those situations tend to be where the patients failed therapeutic, like antibiotics. They failed antibiotic therapy multiple times. So it's very specific cases, very specific settings, and certain people are doing this. So your physicians, your healthcare teams, not Jenny down the block.
Okay, but
Jenny
this
down the
looks like
block.
health talk is on the move again, right?
So our fecal transplants can reduce symptoms of depression and anxiety. Kind of exciting because you're no longer depressed or have anxiety. So in 2020, studies found that people were showing decreased depression, anxiety, and due to some of these transplants that were seen. So additionally, in that same study, it showed the first two patients with major depressive disorders had this therapy and saw some improvement, saw some behavioral improvement as well. So tying that whole gut-brain axis, that we actually have this bidirectional communication system between the gut and the brain can play that crucial role to help kind of balance out neurotransmitters, immune responses, and our mental health. So it's pretty impressive and exciting what that connection is.
Yeah, well, clinical applications of FMT is still under investigation, just like Melanie said. It's not actually FDA approved. Some in the home setting, some individuals have turned, like we mentioned before, to Amazon and YouTube for these DIY methods. And so one notable case that we like to mention here is of an individual named Jane Dudley, who is an Australian woman who, after 18 years, had been actually struggling with bipolar disorder. And she underwent a series of home administered FMTs using her husband's stool. So, again, that similar environment, probably eating the same thing, same dinners, same pantry for snacks. And remarkably, she reported after a few sessions, I guess I would say, of this DIY FMT, complete remission of her bipolar symptoms with no manic episodes since 2017, which is pretty remarkable.
Their claims are impressive. I mean, and almost unbelievable, right? Like I don't know. I feel like this approach is fraught with risks. You've got experts, cautioning against DIY anything healthcare, right? Due to potential transmission of infectious agents, lack of standardized protocols. Again, the FDA has approved FMT only for specific conditions like recurrent C. diff infections, strict medical supervision for these. And like, as Erin mentioned, like, it's kind of like a last effort type of situation. You do it after like you've kind of exhausted other options of mediating that infection. So
Yeah,
I don't know.
true. I mean, you are having to meet a clinical standard before you're doing this. You're having to show that there has been therapeutic failure. You're not just your doctor's just not running by the taco stand and running for the border and then getting a blender out and putting this in place for you. So, I mean, despite all these kind of anecdotal successes, there are lots of significant concerns. There is that lack of donor screening that Melody had kind of talked about. Um, all those potential pathogens that we kind of mentioned. So if there is a foodborne illness or something that might be part of their gut. So some people are actually colonized with Clostridioides difficile, so with C. diff, and they're not symptomatic. So that little bit of that could be an issue. So there are pathogens and bacteria that you want to make sure you're screening out for. And there's not really that oversight, so it is kind of risky. So yes, we were happy for your success, but the next person down the block, the next cup of poo, could not work the different bacteria. So they're
Yeah,
risky.
I think we've already kind of discussed there is a clinical use case for FMT that, when done properly and in the right setting and with the right medical oversight, is completely appropriate and very helpful to patients who have specific conditions where they might need this. But in terms of DIY, I think the media or the general media has really tried to warn us for a while about this. In a 2020 article from Very Well Health, it emphasized that FMT should only be performed under controlled conditions to ensure exactly what you're saying, Aaron, all of those infection control and safety risks.
Yeah, I also think like, what about the ethical implications of like self-administrating treatments without medical guidance? Because if you're desperate, right? If you've got bipolar disorder, I mean, I think about the patients, right? Like in their situation, or you have severe anxiety or depression. Um, you may think the potential for harm is very low because you're already in a very vulnerable place clinically and really just personally and physically. But the need for rigorous clinical trials and regulatory oversight before FMT really needs to like be part of the conversation before we can consider this a viable treatment for mental health disorders. But I can see the disconnect for the person, right? Like I'm
Yeah,
experiencing this and this has worked for someone else who also had manic issues. Like I might need this,
yeah,
right?
I found something,
Yeah.
and then yeah, we are in a time period too where it's a how-to for everything on YouTube, and you catch yourself with, oh, I
Mhm.
need to change the something with the washing machine or something. Let me go YouTube it, or I need to change my oil for
Mhm.
some reason, and you go on YouTube and kind of find that. So
For
expect
some
to
reason,
find
I need to check my
something
oil.
like this. Yeah, I do need to change my oil in my car. So kind of while the concept of using our fecal transplant as a treatment option for mental disorders it's intriguing, it's exciting, especially for I've known people that have bipolar disorder, and if they had a quit, even in this case, if they had that as a treatment option and it worked, it'd be exciting. Um, Clinical trials and studies are underway, so we still have to explore the efficacy behind this, the safety for our psychological conditions. So, what strains are we using? Are they actually impactful in every patient? So, for instance, researchers at the University of Calgary are investigating fecal transplants as treatments for major depressive disorders and obsessive compulsive disorder. So, we're in the works.
Yeah, but we can't stress enough, and we've done a few episodes on DIY healthcare things. And so we want to continue to stress as, we make light or we may talk freely about these things that as we wait on more conclusive evidence on some of these do-it-yourself procedures, it's essential that you approach particularly this one of DIY fecal transplant with caution. Although, like Aaron said, it does sound intriguing for those who may have conditions that you really are passionate or wanting to find some resolve to. Individuals interested in exploring this as an avenue should definitely consult with a healthcare professional and consider participating in clinical trials so we can get more information about, these do it in your own home setting um, healthcare procedures to ensure that there is safety, to make sure there's proper instructions, to make sure that there's proper outcomes. And we can help use all of this information from you participating to contribute to the scientific understanding of this as a potential treatment.
So,
Yeah,
That's
I mean,
Stephanie. Oh, I'm sorry.
sorry.
Would you
No, go
consider
ahead.
this? Would you consider this not a number 1 treatment, but a number 2 treatment?
I
That's
see
so
what you did
bad.
there.
That's
I
so
see what
bad.
you did there.
I was
Sorry,
about to say
Melody.
something like really seriously
Oh,
meaningful, and now I don't
okay.
even know how to like follow that up.
I'm sorry. Keep going. Okay.
That
Back to the
was
profoundness.
good.
Like,
Okay.
I was like
Sorry.
really
Back
like
to Dr. Nelson.
I've
Dr.
been really
Nelson.
like sympathetic in this thing today, but like I think about like the importance of hope in medical care and treatment.
Yeah.
Like you think about cancer and you think about Parkinson's and some of these diseases and Alzheimer's and the idea of like hope is on the horizon, right? And I know that I just read an article the other day about a patient who overseas elected for basically end of life measures because she had severe bipolar disorder. And so when you read things like that, it's hard for those of us who don't experience those conditions to really put ourselves in that position of like maybe being so desperate we would try a DIY fecal transplant. Do you know what I mean? Like like wanting that. And you might have a family member who says like that could be hope, right? If it works, if this University of Calgary study comes out and it's positive, like what does that mean for us? You know what I mean? As society, like does this health tax type stuff like increase around FMT? But I do think we have a responsibility as laboratory professionals to really educate the public and like family and friends, like if you hear about this, like point them to the research,
Mhm.
and what's going on. And that hope may be on the horizon, but we just don't have the answers yet,
Mhm.
Yeah,
For sure.
I completely agree. Yeah, so you can read more about the microbiome and the connection to the brain. That's always a great place to go. So thank you guys for joining us on this deep dive into a do-it-yourself fecal transplant, the potential mental health impacts, and then even while on the horizon, the whole gut-brain connection. If you want to learn more about that, it's an exciting field. And learning about the strains, it's crucial to kind of, with all this excitement, crucialize our safety and the scientific evidence before you do these things.
So thank you for tuning in today for another episode of SUPERSTAT. Stay tuned for more episodes where we continue to explore the evolving landscape of healthcare, do it at home and do it in a hospital, and laboratory science.
Yes.
Until next time, stay curious, stay informed, follow us. We're super excited to see the numbers on our social medias increase. But if you like something, please share it. Please follow us so you can stay connected with us and we can stay connected to you. We'd love to hear your comments on this episode. So reach out to us and let us know what your research has found.
Yeah, I learned something new like with this episode in terms of just I didn't even know that there was a mental like health consideration for this. So yeah, we can all learn together and from each other. If you are familiar in this space, we'd love to see some comments from you or some share your information with us and the group by commenting below. And we hope that you stay SUPERSTAT. Bye.